Hemorrhage. Chapter 115. Definition. Hemorrhage is defined as the excess loss of blood due to rupture of blood vessels. Types and causes of hemorrhage. Hemorrhage occurs due to various reasons. Based on the cause, hemorrhage is classified into 5 categories. 1. Accidental hemorrhage. Accidental hemorrhage occurs in road accidents and industrial accidents, which are very common in the developed and developing countries. Accidental hemorrhage is of 2 types: primary hemorrhage, which occurs immediately after the accident. Secondary hemorrhage, which takes place sometime, about few hours, after the accident. 2. Capillary hemorrhage. Capillary hemorrhage is the bleeding due to the rupture of blood vessels, particularly capillaries. It is very common in brain, cerebral hemorrhage, and heart during cardiovascular diseases. The rupture of the capillary is followed by spilling of blood into the surrounding areas. 3. Internal hemorrhage. Internal hemorrhage is the bleeding in viscera. It is caused by rupture of blood vessels in the viscera. The blood accumulates in viscera. 4. Postpartum hemorrhage. Excess bleeding that occurs immediately after labor, delivery of the baby, is called postpartum hemorrhage. In some cases, it is very severe and leads to major complications. 5. Hemorrhage due to premature detachment of placenta. In some cases, the placenta is detached from the uterus of mother before the due date of delivery, causing severe hemorrhage. Compensatory effects of hemorrhage. Many effects are observed during and after hemorrhage. Effects are different in acute hemorrhage and chronic hemorrhage. Acute hemorrhage. Acute hemorrhage is the sudden loss of large quantity of blood. It occurs in conditions like accidents. Decreased blood volume in acute hemorrhage causes hypovolemic shock, Chapter 116. Chronic hemorrhage. Chronic hemorrhage is the loss of blood either by internal or by external bleeding over a long period of time. Internal bleeding occurs in conditions like ulcer. External bleeding occurs in conditions like hemophilia and excess vaginal bleeding, menorrhagia. Chronic hemorrhage produces different types of effects such as anemia. Compensatory effects. After hemorrhage, series of compensatory reactions develop in the body to cope up with the blood loss. Compensatory effects of hemorrhage are of 2 types. Immediate compensatory effects. Delayed compensatory effects. Immediate compensatory effects of hemorrhage. On cardiovascular system. Reduced blood volume after hemorrhage decreases venous return, ventricular filling, and cardiac output. In severe hemorrhage, there is fall in blood pressure also. However, when blood loss is slow or less, the arterial blood pressure is not affected much. If it is affected, it is restored quickly. During mild hemorrhage. During slow or mild hemorrhage, when there is loss of a small amount of blood up to 350 to 500 ml, the blood pressure decreases slightly and soon it returns back to normal. Mechanism involved in maintenance of blood pressure. Usually when arterial blood pressure increases, the carotid and aortic baroreceptors are stimulated and send impulses to brain, resulting in decrease in blood pressure, Chapter 103. During hemorrhage, when the arterial blood pressure falls, baroreceptors become inactivated and stop discharging impulses. This increases the vasomotor tone, leading to vasoconstriction. This type of reflex vasoconstriction occurs in all regions of the body except brain and heart. Vasoconstriction results in increase in the peripheral resistance. Loss of blood also causes reflex constriction of veins. Venoconstriction enhances the venous return, ventricular filling, and stroke volume. Thus, because of increased peripheral resistance and stroke volume, the arterial blood pressure is restored. One more factor is involved in this mechanism. Vasoconstriction occurs in the organs having reservoir functions such as skin, liver, and spleen. Blood from these reservoir organs is directed into systemic circulation. This may compensate the volume of blood that is lost during hemorrhage. During severe hemorrhage, When hemorrhage is severe with loss of about 1,500 to 2,000 ml of blood, the arterial blood pressure falls to a great extent. It is because of decreased venous return and stroke volume. In the heart, the reflex tachycardia increases the quantity of metabolic products in myocardium. These metabolic products cause coronary vasodilatation. On skin, vasoconstriction in skin, which occurs after hemorrhage, decreases the cutaneous blood flow. It increases the deoxygenation of blood and large quantity of reduced hemoglobin is accumulated in cutaneous blood vessels. It results in grayish pallor color of skin. Sometimes cyanosis develops in certain areas of the body. Skin also becomes cold due to less blood flow. Sweating is decreased. On tissue fluid, arteriolar constriction decreases the capillary pressure. Therefore, tissue fluid enters capillaries. It helps to compensate the blood loss. It also causes hemodilution. On kidneys, constriction of afferent and efferent arterioles of kidneys after hemorrhage decreases the glomerular filtration rate, GFR, very much. Therefore, the urinary output decreases. The blood level of nitrogenous substances, particularly urea, increases, resulting in uremia. Severe hemorrhage leads to fall in arterial blood pressure and damage of renal tubules, resulting in acute renal failure. On renin secretion, hypoxia produced after blood loss increases secretion of renin from kidney and the subsequent formation of angiotensin II. Angiotensin II helps in restoring blood pressure by producing generalized vasoconstriction. It also increases release of aldosterone from adrenal cortex. Aldosterone causes retention of sodium, and this helps increasing the blood pressure. Angiotensins 3 and 4 are also involved in restoring the blood pressure, Chapter 50. On secretion of antidiuretic hormone. Antidiuretic hormone, ADH, is released in large quantities immediately after the hemorrhage. It is probably due to increased osmolality of body fluid by aldosterone-induced sodium retention. ADH promotes water retention and helps in restoring osmolality and volume of ECF. On secretion of catecholamines. Sympathetic activity increases due to blood loss. It causes secretion of large quantities of catecholamines, which are also involved in restoring blood pressure by the vasoconstrictor effect. On respiration. Hemorrhage causes stagnant hypoxia because of decrease in venous return, cardiac output, and velocity of blood flow. Hypoxia stimulates the chemoreceptors, leading to increase in respiratory rate. The catecholamines, which are secreted in large quantities due to hemorrhage, increase the respiratory movements through reticular activating system, RAS. On nervous system. On brain. Though hemorrhage causes vasoconstriction in many organs of the body, it causes vasodilatation in brain. It is because of increased sympathetic activity. However, the blood flow to brain is not affected very much after hemorrhage because of autoregulation. On reticular formation. Catecholamines stimulate the RAS. It causes restlessness, anxiety, and increased motor activity after hemorrhage. The respiratory movements are also accelerated due to stimulation of RAS. Fainting. When hemorrhage is severe, cardiac output decreases and blood pressure falls. The autoregulation in brain fails to cope up with the hypotension. So, the blood flow to brain decreases, resulting in fainting. Refer Chapter 116 for details. Cerebral ischemia. When the blood flow to brain is severely affected due to hypoxia, ischemia of the brain tissues develops within 5 minutes. It causes irreversible damage to brain tissues. Delayed compensatory effects of hemorrhage. If hemorrhage is not severe, some delayed compensatory reactions occur. These reactions help to restore blood volume, blood pressure, and blood flow to different regions of the body. Delayed reactions are restoration of plasma volume, restoration of plasma proteins, restoration of red blood cell count and hemoglobin content, restoration of plasma volume. During the period of hemorrhage itself, tissue fluid starts entering the blood because of low capillary pressure. So, the plasma volume increases. Because of increase in plasma volume, hemodilution occurs. So, the concentration of plasma proteins and hemoglobin is low. Transport of fluid from tissues is continued for long time after hemorrhage. Restoration of plasma proteins. The reserve proteins stored in liver start mobilizing within few hours after hemorrhage. Liver also starts synthesizing the plasma proteins. Restoration of plasma proteins occurs within 3 to 4 days. Plasma proteins help to retain the fluid transported from tissues to blood. Restoration of red blood cell count and hemoglobin content. Hypoxia that is developed after hemorrhage stimulates the secretion of erythropoietin from kidney. Erythropoietin in turn stimulates red bone marrow causing erythropoiesis. However, restoration of RBC count is a slow process. It takes about 4 to 6 weeks. Reticulocyte count increases in blood. Hemoglobin content also comes back to normal level along with RBC count, if the diet contains adequate quantity of iron and proteins.